Hello, I'm Patel. Today, I'll present to you on the topic of ensuring universal access to quality mental health care. Here's a little bit about me. I am a rising junior and attend Calabasas High School, and this is my first year at the Global Health Leaders Conference. Some activities I enjoy outside of school include raising awareness about mental health through a nonprofit called M2 Health, and I've also conducted mental health research and enjoy playing tennis. In the future, I hope to be a doctor. Now I will be giving an overview of mental health illnesses and mental health care. Mental health is extremely vital to an individual's well-being. However, mental illness is prevalent in society today. According to the World Health Organization, there are over 200 different mental disorders, and as seen in the graphic in the top corner, they can be categorized in many different ways. And as of today, the most common mental health disorders are anxiety disorders, 301 million people, depression, 280 million, and bipolar disorder, 40 million. And mental illnesses also commonly stem from past experiences of trauma or abuse, substance use, and more. Fortunately, there are many types of mental health care that someone can receive. The most common treatment includes psychotherapy, medication, hospitalization, self-education, using support groups, and electroconvulsive therapy, which uses deep brain stimulation, as shown in the photo. So, why is ensuring access to mental health care so important? Well, currently, 1 in every 8 people, or a total of 970 million people around the world, live with some type of mental health disorder. Adding on to that, according to the CDC, during the COVID-19 pandemic, mental health disorder rates increased by around 25% and created a parallel epidemic at the same time. In addition to this devastating epidemic, well-respected individuals such as Antonio Gutierrez and Dr. Tedros Ghebreyesus have called for universal mental health care coverage. But what exactly are the barriers to seeking mental health care? So the 3 most common global barriers to mental health, as confirmed by the WHO in scientific studies, such as the one done here by Coombs et al. And shown in the graph, can be narrowed down to financial barriers, stigmatization, and negative attitudes or cultural values. And as these are the most common barriers, efforts to ensure access to mental health care are largely concentrated in these areas. So I conducted an original research project that aimed to see the differences in barriers to seeking mental health treatment among first and second and later generations of Asian Indians. As you can see by the descriptives on the right, the three most common barriers I identified were fear of stigmatization, the high cost of mental health services, and the negative attitudes of society towards mental illness. I was originally very surprised that even though Indian Americans have the highest median household income in the United States, that the high cost of services would be identified as a barrier. However, this just highlights how bad the barrier of high cost actually is. And although this study was conducted on a certain demographic in the United States, a country without universal healthcare, these results can still be observed on a global scale. In reality, only 72 countries around the world offer universal healthcare and 154 don't. So a lot of the financial barriers around the world still stand. And even in the smaller portion of countries with universal healthcare, citizens have to contribute to the system in other ways, such as tax revenue to pay, as seen in Canada, Australia, and Iceland. So I'm now going to focus on the other 2 most common barriers, which are stigmatization and negative attitudes towards society. And these can be grouped, and the main way to fight these 2 barriers is through education. Specifically, this map displays the types of anti-stigma education movements around the world. A lot of these movements are concentrated in small regions in Europe, North America, and Oceania. Therefore, although good progress is being made, there's still a long way to go in continents like South America, Africa, and Asia. However, there is a way in which we can target these barriers using the information from the past 2 maps. Using the strategies of the highest ranking countries, the first conclusion we can reach are that based on this map of qualities of healthcare around the world, the highest ranking countries, shown in purple, have a universal healthcare system with a twist. This means that they have a universal healthcare system, but they can invest more money into mental health care through social and private insurance partnerships, according to the Wise Voter Institute Country Tracker. Countries like Iceland, Australia, and Canada have this system in place, are among the highest ranked countries in the world. And secondly, most of the highest rated countries also have strong anti-stigma movements to educate individuals about seeking proper mental health care, as shown in the previous slide. And using these insights, we can find a solution to ensure universal quality access to mental health care. So now I'm going to discuss the solution to this critical issue, which is not a one-size-fits-all solution. So using the approaches of the countries with the highest rankings, the two best ways to increase access to quality mental health care would be through dedicating more money to increasing access and or emphasizing education on mental health. Countries can use both approaches or one or the other depending on what works best for them. For developed countries, they have the freedom of using both approaches, but if they had to choose one, they can invest more into mental health care. The universal healthcare with the twist system using insurance partnerships could work very well as they've had in previous countries. In addition, the WHO's special initiative for mental health from the years 2019 to 2023 provides mental health care access to over 100 million people in 12 countries. Um, all that was needed for a country to involve themselves in this was to contribute 1 million USD every year for 5 years. And the strategic actions of this program include advancing mental health policy and setting up professional services in the area. Potential memberships of the WHO can also work with developing countries to provide access to quality mental health care. Finally, education is the best solution for developing countries. And this is because in most of these countries, there are major professional shortages, and these countries are underfunded in mental health services, as shown by the Harvard Global Health graphic in the corner. So some of the alternatives include implementing mental health awareness in the primary school curriculum or holding workshops, seminars, and support groups. In addition, countries can establish anti-stigma campaigns or organizations or follow the United for Global Mental Health and the WHO anti-stigma campaign to educate. Moreover, students can take the initiative to do their part as well, such as I do through M2 Health. In this way, universal access to quality mental health care can be ensured for everyone. So here are my references and some acknowledgements that I'd like to share. To start, I would like to thank everyone at Johns Hopkins University who makes the GHLC possible every single year and gives students like myself an opportunity to present their previous work. And next, I'd like to thank my two research mentors, Dr. Tatiana Bustos and Mr. Brad Bowman, who have guided me throughout my research endeavors. And furthermore, I'd like to thank my family for their undying support throughout my educational career. And finally, I would like to thank everyone for watching this presentation and for their respect. Thank you, everyone. If you have any inquiries about M2 Health or would like to get in contact with me, feel free to email me or add me on LinkedIn as well. Again, thank you so much for watching.